Welcome everyone to today's webinar, The Ins and Outs of Hip Protectors for Fracture Prevention. Today's webinar is facilitated by the Loop Fall Prevention Community of Practice. My name is Michelle Dukeman. I'm the Knowledge Translation Coordinator for the Fall Prevention Program at Parachute. Parachute sponsors the Fall Prevention Communities of Practice Loop and Loop Junior, along with the annual Fall Prevention Month campaign each November. Before we begin, we'd like to start today's presentation with a land acknowledgement. Today, we respectfully acknowledge the land on which we live and work as the traditional, ancestral, and unceded territory of the Indigenous people, Canada's First Nation, Inuit, and Métis people, whose presence reaches back to ancestral time. We respect and affirm the inherent rights and title of Indigenous people of Canada and declare our respect of Indigenous elders, past, present, and future. I would ask that everyone takes a moment to themselves to acknowledge the land where they currently are taking this meeting from. Next, I'm going to cover a few housekeeping items. During the webinar, if you have questions about the technology or you have a comment, please type them into the chat box. My colleague Marguerite will be monitoring this space. And if you have questions for our presenter about the webinar and about the content, please submit that through the Q&A box. They will be answered at the end of the webinar. You will also be able to view questions. You will not be able to view questions that other people have asked. The webinar is being recorded, and a YouTube link will be sent to all participants in a couple of days, along with the presentation slides. You can view previous webinar recordings simply by heading over to the webinar page on Loop and clicking on the Loop Webinar Rewatch button on the menu selection. Or you can visit Loop's YouTube channel. I'd like now to introduce our presenter, Dr. Caitlin MacArthur. Caitlin's research focuses on improving the effectiveness of and access to rehabilitation for people living with chronic health conditions across the continuum of care, particularly home and long-term care. She is interested in fall and fracture prevention and improving functional mobility. With a passion to improve mobility and quality of life of clinically complex older adults, she is a lead instructor of the continuing education course BoneFit, hosted by Osteoporosis Canada, which teaches exercise professionals about safe movements, physical activity, and exercise for people with osteoporosis. For a complete bio on our presenter, please take a look at the Loop event calendar. Without further ado, I'll let you take it away, Caitlin. You can share your screen now.
Great, thanks so much. Just give me a second while I get shared here. All right. Perfect. All right. Thanks everybody for being here today and for listening to talk about hip protectors and how they can help prevent fractures. So first, let's just talk about fractures and the problem of osteoporosis and osteoporosis-related fractures in Canada. So osteoporosis, if you're not aware, occurs when bone tissue loss is faster than normal. And this causes the bone to become weak and fracture easily. So broken bones happen a lot easier. Often people don't know that they have osteoporosis until a fracture occurs. So a lot of times it's not until somebody's had a fracture that they then know they have osteoporosis. The most common places to have fragility fractures or osteoporosis-related fractures, or sometimes we call them low trauma fractures, are the forearm or the wrist, the hip, the spine, the upper arm, and the pelvis. And today we're really going to be talking about hip fractures because that's really what hip protectors are meant to protect against. But we'll also talk a little bit about pelvic fractures as well because those are somewhat related. So just some kind of important stats to take away from this figure that was put together by the Public Health Agency of Canada. More than 1 in 5 Canadians with a hip fracture died of any cause within the following year. So hip fractures are really a very serious event. They can really change somebody's trajectory, and people who have a hip fracture are more likely to die within the following year from any cause. So it can really be that kind of event that causes then a downhill spiral for the person. And another really important thing is that less than 20% of Canadians who are 65 plus received a prescription for an anti-osteoporosis medication. So we know that there's like a major gap in treatment for osteoporosis. So people have osteoporosis, they're at high risk for fractures, and they're not receiving treatment for that fracture. So we really want to try to prevent these fractures from happening because they're so serious. Medications are one way. We're going to talk about some other ways in a second, but we know that it's very under-recognized and undertreated. So many, in fact, most hip fractures happen because of a fall. There are other types of hip fractures that can occur, but those are more rare. Definitely the vast majority happen because of a fall. There was this research study done by Rabinovich and colleagues out in BC, and they looked at the biomechanics of falls. So they looked at, they basically videotaped common areas within long-term care homes and characterized how people fell. And they found that the most common reason that people fell was because of incorrect weight shifting and tripping. So there's a few pictures here of what that looks like, and I have a video in a moment that I'll show you of some falls. But people are often not shifting their weight correctly and then tripping over their feet. Another really important thing is that about a third of people who fall in long-term care will hit their heads. And that's often because they might get their hand out in time. Sometimes they don't even get their hand out in time. Or they don't have that reaction time to get their hand out to kind of cushion the fall. But if they do get their hand out, a lot of times people won't have the strength in their upper body to kind of gently lower themselves to the ground or absorb the kind of shock of the fall. So they found that 74% had some hand contact first, but they didn't have sufficient strength to prevent floor contact, both for heads, but also for hips. So someone might be able to get their hand out, but they might not be able to lower themselves to the ground or absorb kind of the forces of the fall through their arms. So that's really important to kind of keep in mind when we think about people falling. So on the next slide, I do have some videos from that study of people falling. I'll warn you that they are people falling, so sometimes they are a little bit hard to watch. So I'll just press play here, but just keep in mind, there are some people hitting their heads and such. So just a little bit of a warning for you there. So you can see, incorrect weight shift, stumbling steps, having some weight shifting issues there and not getting hands out or walking along and then tripping over feet and falling. So you can see in this one, she catches her toe and that's what kind of precipitates the fall. This person here, you can see shifting the weight becomes a problem and they end up landing on their hip. And so that impact right there, that's where a hip fracture is very likely to occur. So now we know fractures are something we want to try to prevent. So how can we do that? How can we prevent fractures? I'm going to be talking about hip protectors. That's one kind of element in fracture prevention, but I just want to mention the others because they are very important. So we should all be aware of them. So first, we want to think about having a bone healthy diet and, if necessary, supplements to support that. So vitamin D supplementation might be necessary. Dietary calcium of 1,200 milligrams per day. So you'll notice that says dietary calcium. So trying to get as much from the diet as possible. And then if it can't be reached for whatever reason through diet, then calcium supplements may be appropriate depending on values and preferences. Healthy lifestyle is also really important. So avoiding smoking and reducing alcohol intake. Medications can help prevent fractures. As I mentioned, many people are not taking medications even when they're high fracture risk. And some of the osteoporosis medications can be quite effective. So it's important to get those on board if the person is high risk. And then fall and fracture prevention strategies kind of from a more global perspective. And here we added the word fall because, as I said, most fractures, especially hip fractures, happen because of fall. So exercise is going to be really important, especially balance, strength, and functional training, reviewing medications, looking at the environment, so making sure there's no tripping hazards, all those types of things, making sure assistive devices are being used where appropriate, and when they are being used, making sure that they are the right assistive device and that they're fit for the person. Managing urinary incontinence is also going to be really important because a lot of times people are rushing to the washroom and that's when a fall can occur. So making sure that a toileting program is implemented or the urinary incontinence has been addressed. And then hip protectors, which we're going to be really focusing on today, is really important for people who are mobile. And you'll see as I kind of present the evidence today, in long-term care especially, they're cost-effective and they do help prevent fractures. So if people are at high risk for fractures and falls, that's where hip protectors can be quite effective. But of course, we always want to consider resources and the residents' values and preferences. And we're going to dive really deep into this topic a little bit later in the webinar. Okay, so we're shifting our focus now to hip protectors. We know why they're important, but what are they? So what am I referring to when I talk about a hip protector? So hip protectors are personal protective equipment, and they are worn clothing or they're hip wraps or something that you kind of place around your pelvis and hips that have special padding on the sides to protect hips during a fall. So basically they have two parts, an impact protector and then the system that holds the protector in place. So the impact protector is usually made of plastic, either hard or soft plastic. There's lots of different designs and we'll talk about a few in a second. Some are designed for just a one-time use and then if they've been fallen on, they need to be replaced. And others are designed for multiple impacts. So somebody who maybe falls more frequently. What's really important is that they don't reduce the risk of falling. So if you think about how they work, it's something that you wear on your body and they don't actually reduce the risk of falling in any way, but they do reduce the risk of fracture in certain circumstances. And they are recommended for those who are at high risk for falls and fractures specifically. So if somebody is at high falls risk or fracture risk, then that's where hip protectors are recommended. So how do they work? So basically they are designed to absorb the impact of a fall to protect the hip bone. So in this figure here, you can see at the top, this is somebody falling kind of sideways and backwards, landing on their hip bone on the greater trochanter there of the femur and sustaining a fracture. And then in the bottom figure here, we have somebody wearing a hip protector, experiencing the same type of fall. And the whole point is to kind of protect the hip during that fall. Now, most hip fractures will happen during a sideways fall that's kind of sideways and a little bit backwards. And they've actually found that a sideways fall produces really high energy impact. So it increases 6-fold the risk of a hip fracture compared to a backward or forward fall, even in younger people. So even for people who are not older, just falling sideways increases your risk for hip fracture quite a lot. And that's often how people will fall. So here are some different types of hip protectors. There's lots of different kind of styles and different options out there. Most of them are some sort of undergarment that are worn under usual clothes. So like underwear with hip protectors on the side. And then others are actual clothing. So they might be like a pair of shorts, like the one kind of in the middle that's blue. That the hip protector is actually built into the shorts or the pants. And then others are more like wraps that you wear, you can wrap over top of clothing. So the ones on the bottom right, for example, are ones that you kind of wrap or wear over top of your clothing. And then there's other ones that are more open to allow for toileting and for incontinence products. So you can see the top right and the bottom left are examples of those. So there's lots of different options. There's ones that are disposable and stick-ons as well. There's a million different kinds out there. And the cost really varies depending on the type and probably the quality as well. But they can range from anywhere to $45 to well over $200. If they're one-time use versus multiple use, that's where you have kind of all these different options. One of the latest trends in hip protectors are these hip protecting airbags, which is basically kind of looks like a belt that you wear around your waist. And they basically inflate during a fall. So they only, the little airbags on the side only come out if somebody is falling. So it has like an integrated electronic system, which detects a fall. And then as the person is falling, those airbags will inflate. One really important thing to kind of notice about these are new. So there's no large scale randomized control trials that has tested the effectiveness or the efficacy of these for preventing hip fractures. They are patented and they're out there, but they haven't been evaluated or assessed to know how good they are at actually preventing fractures. Some people, for them, it might make them more likely to wear them. So it may help with adherence or compliance with wearing them because maybe they're more comfortable. It's more just like a belt. But we don't really know at this point, knowing how effective these are at preventing fractures, but kind of an interesting idea. So recommended design properties. Hip protectors undergo standard biomechanical laboratory testing in a preclinical setting in order to kind of measure and optimize their biomechanical properties before they're allowed to be studied in humans. So there's actually an international hip protector research group that has developed some recommendations based on evidence to properly test the biomechanical efficacy and performance of hip protectors. So basically the overall objective of a hip protector, what they're trying to do with them is to reduce the peak axial compressive force that is applied to the femoral neck when you fall, basically. So basically trying to decrease the amount of compression that goes through our hip when we fall onto it, generally speaking, sideways. So the specifications are listed here for you. You don't necessarily need to know what these are, but do know that hip protectors do go through kind of a rigorous process, and they do have to meet some standards to be tested in humans. Aside from kind of that primary objective of trying to decrease the amount of compressive force that goes through our hip when we fall on it, there's some other kind of properties that they're kind of recommended when people develop hip protectors. So they should be able to protect from falls other than from the side. So most hip fractures happen when somebody falls sideways and slightly backwards, but sometimes people will fall forwards or they will fall backwards kind of onto their bottom. So if the hip protector can help in those scenarios as well, that is even better. Aesthetic characteristics. So we know one of the biggest challenges with hip protectors is people not liking to wear them because they don't look nice, they're uncomfortable. So really, making sure that they are aesthetically pleasing for people as well. Durability is also really important. So making sure that they will last and will sustain a fall, whether that's, they're designed to only sustain one fall or they're designed for multiple falls, but they should be durable as well. Skin tolerance can be a really big issue, particularly for people who are at risk for skin breakdown or maybe already have skin breakdown. So making sure that the material is breathable and it's not going to cause any more pressure injuries or any sort of chafing or anything like that. elastic properties kind of goes along with that, making sure that they're comfortable, they're not too tight, but that they're going to stay in place and stay on, because that's also really important. How heavy they are, because of course that's going to affect how they feel on somebody's body. The cost, and then the capacity to stay in place once positioned. So in a moment, we'll talk about positioning, but that's probably, aside from helping people to wear them and making sure that they are willing to wear them, and finding the best ones for them, making sure that they're properly placed is the next most important thing. So if it's not covering the greater trochanter, it's not going to be very helpful at cushioning any sort of fall or shunting the energy away during a fall. So it definitely needs to stay in place once it's positioned. So in terms of the impact protector, so if you remember back to a few slides ago, I mentioned there's two parts. So there's the impact protector, which is usually made of some sort of plastic, and then the system that holds it in place, which would be like the shorts or the underwear or the belts. When we think about the impact protector specifically, there's two kind of broad categories. So there's one that is energy absorbing and one that is energy shunting. Really, the primary aim of both of these systems is to reduce the energy that's transmitted to our greater trochanter or, the side of our hip during a fall, so that we kind of prevent a fracture. So on the left-hand side, energy absorbing hip protectors are designed to absorb the impact from a fall. And they're usually made of hard plastic. So you can think of this like a crash helmet, for example. So we have rigid pads that spread the energy of the impact to the soft tissues of the thighs and surrounding hips. On the other side, we have energy shunting hip protectors, which are usually made of soft plastic, and they're more shock absorbing. So they're soft pads that decrease the force of impact. So they're basically decreasing the force that's transmitted to the bone. In terms of which one's better, hard versus soft, energy absorbing versus energy shunting, there's very few comparative studies, and any sort of conclusive analysis of clinical effectiveness doesn't really exist yet. So there's really a wide variation in force attenuation depending on the brand of hard versus soft, where it's positioned, all those types of things. But what they did find is that those that cover the greater trochanter provide the greatest force attenuation. So as I mentioned, positioning, it's kind of like real estate, I guess. Location is key. So positioning, making sure that it's covering the greater trochanter is where we have the greatest force attenuation and therefore more likely to prevent a fracture. We also don't know in different populations the comparative effectiveness, for example, long-term care versus community. We don't have any evidence to compare across brands, but kind of the main take-home point is that proper fit and positioning is going to be key regardless of the type. So essentially, it seems like what is the most comfortable for the person that they're most likely to wear, but that will also stay in the proper position, covering the greater trochanter. That's going to be the most effective one. So on that note, how should they fit? So they should be comfortable and they should be easy to put on and take off. And they should also stay in place while walking, sitting, bending, and during a fall. So basically, throughout daily life, they should stay in the same place. And people should be able to function. So they shouldn't be, so uncomfortable that people can't function, or they shouldn't be moving around throughout the day. They also shouldn't prevent independence with dressing or toileting or use of incontinence products. So that's really important when choosing the one that's going to be best for the person. Can they pull them down to go to the washroom and then pull them back up? Or can people who are helping them with incontinence products, can they easily get them down and back up? Or are there maybe better solutions, different ones that you could choose? So I think I've mentioned this a couple of times, but we really want to make sure that the hip protector is positioned over the greater trochanter for maximum protection. because that's where we'll have the greatest amount of force attenuation, and therefore we're a lot less likely to fracture a hip. So for proper positioning, it should be over the greater trochanter, which is about 6 centimeters above the plane of the garment crotch on a torso model. So the pad needs to be about 6 centimeters higher than where the crotch of the garment sits. And that's kind of the most proper positioning. So here's some examples of different types, looking at where the greater trochanter is. So if you see in the figure here, there's the metal kind of stick that goes down, and then it has a hole. The hole is where the greater trochanter is on the model. And then they put a bunch of the different types of hip protectors on the model to see, does it actually cover where that hole is? So you can see in the top row, second from the left, the hip protector is way up top, but the greater trochanter is actually down here, and it's not being covered by the hip protector. And I should also mention the top row is the hard ones and the bottom row is the soft shell ones. Same, you can see in the bottom row, second from the right, the hole is not being covered by the greater trochanter. So it's really important to assess fit when you have people try them on. Make sure that that particular model fits on them and that it is covering their greater trochanter, because they're not all made the same, and we're not all made the same. So we got to make sure that the fit kind of matches the person as well. Now, there also has been some work looking at hip protectors and flooring properties. So there was one randomized control trial that was done in long-term care where they looked at different types of flooring in preventing falls and fractures. So basically they put basically a softer landing surface flooring, but kind of like a more compliant flooring in long-term care homes, and then looked at the effect on falls, fall-related injuries, etc. And so they found that compliant flooring doesn't increase the risk or the rate of falls, but it also doesn't reduce the risk or the rate of falls-related injuries. So it's not likely to cause harm, but there's no clear benefits with this type of compliant flooring. So the authors kind of concluded that there's more research needed on design of safer living environments. So can't really comment necessarily on flooring. And that was one study. Then there was another study done in Japan where they looked at hip protectors versus, or in conjunction with various flooring materials. So they looked at concrete, wood, and tatami. And tatami was like a foam-based flooring, kind of like, those alphabet mats that you might have like in a children's play area, that kind of foamy flooring. And they found that that soft hip protectors against that more foam-based flooring was the best force attenuation. They didn't look at anything else in terms of rates of falls or how people found walking on that type of flooring or anything like that. But they did find that the soft hip protectors with a softer floor had the best force attenuation. Obviously, this is just 2 studies, so not a whole lot of evidence in this particular area. There's definitely a lot more work to do here. But we do have some systematic reviews that describe how effective hip protectors are at preventing fractures. So there was a Cochrane review that was done in 2014. It hasn't been updated as of yet, but it looked at the effectiveness of hip protectors in preventing fractures, and it looked at different settings. So the first was in residential care settings, and they found 14 studies that looked at the effect of hip protectors in preventing fractures. So the authors concluded that there is moderate quality evidence of a small reduction in hip fracture risk. So looking at how many fewer fractures there were, they found that there are 11 fewer people per 1,000 persons who will fracture with hip fractures. With hip protectors. I'll say that again. 11 fewer people per 1,000 persons will fracture with hip protectors. So there is a reduction, overall small, but there certainly is a reduction. Now, they did find that there was a small increase in pelvic fractures with hip protectors. And that was basically one more person per 1,000 would have a pelvic fracture with hip protectors. So this may be because, we're attenuating the force from the hip. That energy has to go somewhere, right? And so depending on the design of the hip protector, that energy could potentially be transmitted more to the pelvis, and then the pelvis may fracture instead of the hip. However, it is quite a small increase. So bottom line is that for those in residential care, hip protectors probably slightly reduce the number of hip fractures. And there may be a slight increase in the risk for pelvic fractures. Importantly, they found there is no effect on other types of fractures or on the likelihood of falling with hip protectors. So people weren't more likely to fall when they were wearing them, and they weren't more likely to break other bones besides hips or pelvis. Now, there was a 2019 study done as well that was a retrospective cohort study that looked at 14 long-term care homes, and it compared falls with and without hip protectors over 12 months. They found that hip protectors, so they basically, watched a bunch of people fall. That sounds really terrible, but they observed a bunch of falls over 12 months, saw if they were wearing hip protectors or not. They found that of all the falls, 60% of those falls, people were wearing hip protectors. And they found that the risk of hip fracture was reduced by nearly threefold by wearing a hip protector at the time of falling. So if the person was wearing a hip protector when they fell, their reduction in hip fracture risk was nearly threefold. So quite a big decrease in risk. And that's a pretty high adherence rate too, that 60% of falls, people were wearing a hip fracture. So that was kind of interesting. So certainly there's evidence that they can be effective in residential settings and long-term care settings. So what about in the community? So the same Cochrane review looked at community setting. They only found 5 studies this time, and there was moderate quality evidence as well of a little or no effect on hip fracture risk. So they had a slight increase, 2 or more people per 1,000 persons will fracture with hip protectors, but this was very, very small. It was really little or no effect. They also found that there was no effect on falls, and there were some adverse events reported, like skin irritation, for example. And this was 0 to 5%, both in long-term care and the community. So bottom line, for those living in the community, hip protectors probably make little to no difference to the risk of breaking a hip. So we know that they are more effective in long-term care, or we know that they can be effective in long-term care, not as effective in the community. But existing research evidence is, flawed and limited. So we have conflicting or poor results that we can attribute to methodological issues with the study. So first things first, and this is both in research and in practice, we see very low adherence rates. So people aren't wearing hip protectors, and that's, could be for a variety of reasons, which we'll talk about in a second. Sometimes these samples include people who are at low risk and people at high risk for a fracture. So this is important because if people are at low risk, they're already not as likely to fracture anyways. And so when we look at that statistically, it can kind of dilute our results a little bit. So when we mix those 2 samples together, it's hard to know if they're effective or not. We have a lack of standardized validation of devices. So, we're not necessarily looking at the same types of devices. And there's no consistent method of measuring adherence and compliance. So in a study, it's really hard to kind of keep track of if somebody's wearing it or not. So that kind of leads to results that might not be as good as we would like. So point of this, I guess the main point to take away is that more research is needed in this area. That we really need, to answer this question well, we need more research, more good quality research. So are they cost effective? So the answer is yes. In long-term care and geriatric settings like geriatric slow stream rehab or wards with people who are at high risk for falls and fractures, they definitely are effective. Fractures cost a lot of money. If you think about what happens after a fracture, the person might be transferred to the hospital and then they're in a hospital bed, which usually costs more money per day. Perhaps they need to have a surgery, which also costs more money. And then maybe they need more rehab after the surgery, which costs more money. And certainly thinking about quality of life for the person as well. So the more fractures we can prevent, the higher the cost savings for sure. So a 2020 review of economic evaluations that mostly had high methodological quality, so they were good, quality research studies that looked at the cost effectiveness of hip protectors, found that using them in long-term care facilities and geriatric wards, that they were cost effective. So this 2020 study was concluded that they certainly are cost effective in those settings. In community settings, this is where, again, the research is inconclusive. So we just don't know enough yet. So kind of in summary, there is definitely value in using hip protectors. They probably reduce the risk of fractures if made available, worn properly and regularly, particularly in long-term care or more residential settings. They won't increase the frequency of falls, though they may slightly increase the risk of a pelvic fracture. And we kind of need to understand why people will accept them and wear them. So what do we know? So there was a really great study done in 2015 that looked at barriers and facilitators in long-term care specifically to using and wearing hip protectors. So they identified them at different levels within the long-term care home. So the first was at the system level. They found that things that kind of facilitated their use were the facility having a commitment to a hip protector program. So kind of coming from the organizational standpoint. Having structured education on hip protectors and provision of garments at no cost were also really helpful. So educating staff about how they work, when to wear them, fit, all that kind of stuff. And then providing them at no cost also facilitated their use. And having support from external sources. So external agencies like general practitioners, quality and safety boards, really helped, especially with the organizational commitment. So if other kind of external sources supported their use, then people were more likely to use them. From a staff standpoint, if staff had positive attitudes regarding the effectiveness of hip protectors and they were committed to work with hip protectors, then they were more likely to be used, which makes sense. And then from the resident perspective, at the resident level, if they recognized, the resident or their family member recognized the need for hip protection and why it was important, if they had positive attitudes regarding the effectiveness of hip protectors, if peer or families were really advocating for their use, they were more likely to be used. Incontinence materials, if people were wearing incontinence materials, they were more likely to want to wear them, to accept them, compared with those who were not. Or if people had physical or cognitive disability, they were more likely to wear them as well. From the hip protector characteristics themselves, things that were facilitating in their use was color steadfastness. So making sure that they kind of stay the same color, especially after being washed several times or washed with chlorine, for example, that was really important. And they found that tan or beige or like neutral color garments, skin colors were kind of the most likely to be accepted by the resident because they kind of blended in. They also found that soft shell hip protectors had a higher adherence rate versus hard type, especially for those who wore them overnight. So people who might be at risk of falling out of bed or getting up during the night to go to the bathroom and then falling. So soft shell was better, especially for those people who wore them 24 hours, likely because they were more comfortable than having something hard kind of on your leg while you're sleeping or on your hip. For barriers to use at the system level, laundering issues were reported. So having hip protectors that were clean available was an issue. So sometimes there wouldn't be clean hip protectors available, especially those who required, frequent laundering. So maybe because of incontinence or other issues. Or they could get damaged or lost in the laundry. Some can only be laundered a specific number of times before they need to be replaced. So that was certainly a barrier. Having high leadership turnover is a challenge. So if, leadership is constantly turning over, you don't have that same support for programs. Insufficient staffing, which we're definitely facing during and kind of pre-COVID, we definitely faced it, but during COVID, this is even more of a challenge. So having more workload, not enough time to help with things like hip protectors. And then communication breakdowns. So, the fact that the person is wearing a hip protector, maybe it's not documented in their care plan. Maybe care aides are not aware of the fact that they should even be wearing them, or they don't understand the benefits. So not having time, but also not having that good communication of why they are important. From a staff perspective, barriers are things like negative perceptions of hip protectors. So staff having concerns about things like hygiene, cost effectiveness, maintaining dignity of residents, the side effects, particularly for skin like pressure damage or redness, amount of effort to don and doff. So some of them could be quite challenging to put on, or if somebody has, maybe doesn't like to get dressed or doesn't want to wear them, then it can be quite challenging to help them with that. It could be perceived as time consuming and stressful by night staff, that people don't like to wear them, so why are we making them wear them? And so clearly those could be barriers. And then a perceived clash with residents' rights to individual choice and autonomy. So difficulty understanding residents' decision to kind of wear the hip protectors or not. So in some situations, for example, staff made the decision not to offer hip protectors because they perceived they would be like forcing the resident to wear the garment against their will. And they wanted to uphold their rights and individual choices and autonomy, which is obviously important. At the resident level, barriers are things like social or economic disadvantage. So there's lower compliance for people who are not white, are a migrant or immigrant, and who receive welfare. So that could be related to cultural values. It could also be related to financial situation. Fatalism and depression. So feeling like, well, this is the end of the life. I'm depressed. I have poor mood. So I don't want something else to deal with. And it's uncomfortable. So why would I want to wear it? Persistent incontinence. So the relationship between incontinence and compliance was mediated by the frequency of incontinent episodes. So persistent urinary and bowel incontinence were identified as potential barriers to acceptance and adherence. So if people were persistently incontinent, then they were less likely to wear the hip protectors. Prioritizing other care needs. So people may be living with multiple, or that are likely living with multiple chronic illnesses. And so prioritizing other things over a hip protector was sometimes, why people didn't want to wear them. From The hip protector characteristics, so discomfort. So this was usually more associated with the hard shell protectors, but was also often associated with poor fit. So if they were too small, too tight, or bulky. Side effects like making them feel aches and pains, swelling, itchiness, skin irritation, distaste. So maybe they don't look very nice. Maybe they have stains or they're discolored. People didn't want to wear them. And then complexity with donning and doffing. So sometimes people may lose independence for being able to kind of pull up their underwear or pull up their pants because of the hip protector. And then obviously that is not a great situation. If somebody had arthritis in their hands, for example, it might be a big challenge to pull it up. And so that can certainly be a barrier. From in the community, similar things were found. So, having positive beliefs about their benefits, its comfort, its fit, making it easy to get on and off, perceived protection and appearance for all factors facilitating use, whereas barriers to use were low self-efficacy, poor health, problems with getting it positioned properly, incontinence, perception of low fracture risk and effectiveness, adverse events, reduced quality of life. And they found in community developing older adults that men were less likely to be offered hip protector use. So does adherence vary based on type of hip protector? So we said, oftentimes the socks were more comfortable, but when they looked at it in a study, they actually found that it doesn't really vary by type of hip protector use. So basically what they found is that beliefs that wearing hip protector will reduce fracture risk was very important to adherence. And that was independent of the type of protector that was being used. So basically whether people believed they would protect them from fractures or not was more important than the actual type. So it probably comes down to, individual preference and how comfortable it is, what it looks like, all those types of things. So just to wrap up, some strategies to improve adherence are, providing opportunities to select and try different products. I showed you there's many different types. So giving people opportunities to try out different things can be really important. Providing them at no cost. So if there's a way they could be subsidized or something to help with the cost, that will be very important. Making sure that they fit properly and encourage selection of hip protectors with documented protective effect. So they should have, packaging that tells you how effective they are at preventing fractures. And then from kind of the engineering standpoint, when they're building these hip protectors, making sure that they're designing them to be comfortable, easy to take on and off, making sure they look nice and they're tailored to specific tastes. And then education is going to be really important as well. So this is where you may come in around, risk factors, needs, benefits, and really the education can focus on various people. So older adults, peers, family educators, lots of different places. There are some patient education tools out there. Here's just 2 examples for you. So there's a great video at Aging is a Contact Sport. And then Fraser Health has put together a pamphlet on what hip protectors are, how they work, and how you can, think about the right size and fit. So for selection, as I mentioned, they should have a CSA label that includes instructions on the proper positioning, the number of times it can be cleaned and disinfected. The maximum that you should see should be 30. It should tell you whether it's single individual use or institutional use, obviously after cleaning and disinfecting. So is it, supposed to be just one person, or can multiple people use it after cleaning and disinfection? Any sorts of warning or issues with other medical devices should also tell you the single impact, whether it's single impact or multiple impact use. So is it after somebody's fallen on it, do you have to get a new one, or can they wear it multiple times to prevent fractures from multiple falls? And then it should also have a protective value. So the protective value is how much the hip protector reduces the force during a fall. This is a number between 0 and 100. And the larger the number is, the greater the protection. So a higher number, closer to 100, you'd have greater protection. So do make sure if you're looking at hip protectors that you look at the CSA label, you kind of answer all this, and does that align with the person who's going to be wearing them? So final word about fracture prevention. As I mentioned at the beginning, there's really no single solution to preventing fractures. It's really multiple multifactorial interventions that are going to be important. It really depends on the person's fracture risk as well, so whether they're high risk or low risk. But we really need to think globally about fracture risk. So, first assessing what is their fracture risk, looking at adapting the environment, patient education, provider education, family education, making sure exercise is being covered. Hip protectors are one part of it. That's what I've talked about today. But then also considering vitamin D, calcium through diet and supplementation. Medications might be appropriate, and lifestyle changes. So really it's a global approach to preventing fractures, where hip protectors are one part. We do have lots of materials on the website for the osteoporosis strategy for long-term care in Ontario. So you can just go to JERA Center, or just Google JERA Center, and if you click on osteoporosis LTC, we've got lots of information for you. So there's toolkits on assessing fracture risk, fracture prevention guidelines, tools to support the implementation of those guidelines. We have some videos on osteoporosis, residents' experiences with osteoporosis, and exercise programs to prevent fractures. And you can download all of these. So definitely worth checking out. So I'll end it there and see if there are any questions.
Fantastic. Thank you so much, Caitlin. Really want to thank you for a super informative presentation, from the types available to the best available evidence, and then to barriers and facilitators for use. It really covered it all. So thank you. We did have some questions come in through our Q&A box. So we're going to address those momentarily, but first, I'm just sharing your contact information here for people who may need it, and a few other housekeeping items before we address questions. Is that once the webinar has ended, you will be redirected to Zoom and invited to participate in a short evaluation survey. So please do click the blue continue button on your browser and you'll be redirected to that survey. It's very helpful and it will help us to continuously improve these sessions for you. So with the time we do have left, I'm gonna kind of start at the top of the list of questions and see how many we're able to get through. But the first question is, if a person has a falls risk and already has a ORIF or replacement of a hip, is it still appropriate to recommend hip protectors?
So there's most of the evidence is about people who haven't had a fracture yet. As far as I'm aware, there aren't any contraindications to wearing a hip protector if somebody's already had a fracture in the past or they have a healed ORIF, for example. I wouldn't have them wear it like if they've just had their surgery or they're kind of in the recovery phases. They maybe still have an incision on their hip because you're adding layers and tighter layers to that incision. But if it's healed, I as far as I'm aware, there aren't any contraindications to that. I just wouldn't have them wear it in kind of that acute phase after they've had their hip fracture.
Right. Thank you. The second question is, are hip protectors available through AADL? I'm not familiar with that acronym, and so if you aren't either, don't worry.
I am not familiar.
All right, I wasn't sure. I'm not the content expert, so I was like, oh, maybe that's a commonly used acronym. So sorry to the question asker, we can't answer that one right now. The next one is, how long can the stick-on hip protectors stay on for? If you know anything about this, if you don't, no worries.
Yeah, I think it would depend on the actual, the brand and all that kind of stuff. I don't think it's a very long time. I think it would be, hours to days. It wouldn't be a long time that you would want the person wearing it, just from a skin integrity perspective. But it would say on the packaging as to how, like, what's the maximum amount of time they could wear it.
Right. Great. And so AADL is Assistance to Purchase Assistive Devices for Living. So are hip protectors available through Assistance to Purchase Assistive Devices for Living?
That's a good question. I don't know the answer to that. Yeah, I don't know. They might be, but I'm not sure. Yeah, and it might be, if they are, it might be certain types or not, which I don't know the details of that.
Right. The next question is regarding the testing for hip protectors. They said, I heard that some brands can actually increase your risk of a hip fracture because we do not have CSA standards in Canada. But I think we do have CSA standards. So I'm not sure if you have any comment on that about the increase of risk for a hip fracture.
So as you would have seen in the Cochrane review, when we looked at community, there is actually a small increase in the risk of hip fracture in the community. Of course, there was methodological issues with studies, so we don't know if that's people who are already high risk or low risk, high risk, hard to know. We do have CSA standards in Canada, so I would just make sure when you're looking at purchasing a hip protector that you choose one that has all of the things that I kind of outlined at the end of the presentation there. So make sure that it has kind of met those standards, because I mean, yeah, if somebody could just make a hip protector and sell it, and it's just kind of like made up by whoever, but you want to make sure that the one you're purchasing does meet those requirements. So just look at the packaging, look at the brand, and make a decision based on that.
Awesome, thank you. The next one I think is looking at it, it's more of a comment. It's just hip protectors are also made of open cell foam, which are both energy absorbing and shunting. These have been studied in Dr. Robinovich's lab and compare very well in terms of efficacy and are accepted by end users better than either hard or soft plastic.
Great, that's awesome to know.
Yeah. The next question surrounding how do you have people try on hip protectors when companies consider them to be like underwear and will not allow returns of the product? They are a very pricey product to take home to a senior and find they don't fit or not liked. I don't know if you have any tips or sentiments there.
Yeah, that's it. That's definitely a good point. Certainly the ones that are like an undergarment, you usually can't return. So I'll speak from the long-term care side of things. In the community, again, our evidence is kind of mixed. So there you kind of have to make a decision for yourself. But in long-term care, where we know it's effective, I know some homes have purchased kind of a whole bunch of different types of hip protectors and quite a number of them. And then they have them so that people can try different kinds, and then they launder them in between. So they're not necessarily returning them to the manufacturer. They just have like a kind of a supply of them that people can try. And then once they've decided on one, then they'll have the person purchase it and purchase their own. So yeah, I don't have a solution for the community, but I know that's what some long-term care homes have done so that they can try a variety. So the home might try, buy 4 different kinds and buy a bunch of those, like, 5 or 6 within each of the 4 different kinds, and then maybe some different sizes in there. And then they have those for people to try on, and then they'll launder them in between. So that's the solution for long-term care. I don't have an easy solution for at home, and the evidence is a little bit mixed for at home anyways. So we're not really sure if they're effective in that setting or not.
Great. Thanks so much, Caitlin. So we've got 1 minute left, so I'm going to wrap up. We have some outstanding questions left that I'll be able to just download a report of, and we'll try to get those to folks as some answers to those as soon as we can. But I just want to say thank you again, Caitlin. That was such an incredible presentation, and we're so lucky to have you today. And we look forward to maybe having you back in the future.
That's great. Thank you so much for having me.
Thanks, everyone. Have a great afternoon, and thanks for joining us today.